Good morning for all of class. Today I will deliver a topic about echocardiogram. Echocardiogram, or echo, is a painless test that uses sound waves to create moving picture of your heart. The pictures show the size and shape of your heart. They also show how well your heart chambers and valves are working. Echo also can pinpoint area of heart muscle that aren't contracting well because of poor blood flow or injury from a previous heart attack. A type of echo called Doppler ultrasound shows how well blood flow through your heart chamber and valves. Echo can detect possible blood clots inside the heart, fluid build up in the pericardium, and problem with the aorta. The aorta is the main artery that carries oxygen-rich blood from your heart to your body. This is the several brief history of echocardiogram. The importance of echo reflection. The concept behind echocardiogram was firstly demonstrated by Lazzaro Spallanzani when he showed that reflected echo of inaudible sound enabled bats to navigate. Then Lemis Richardson was suggested that an echo ringing technique could be used to detect underwater objects, was followed by the development of sonar or sound navigation and ranging system to be used for detecting enemy submarines during World War I. In 1842, Christian Johann Doppler noted that the pitch of a sound wave varied if the source of the sound was moving. Then the Carl Theodor Radusik was the first to apply ultrasound for medical diagnosis in 1941. He tried to outline brain using echo transmission. He can be regarded as the father of diagnostic ultrasound. Then Helmut Hertz was a physician that obtained a commercial ultrasonoscope which was being used for non-destructive testing in 1953. Then he collaborated with Inge Adler, who was a practicing cardiologist in Sweden. Both of them began to use this commercial ultrasonoscope to examine hearts. This collaboration is commonly accepted as the beginning of clinical echocardiogram as we know it today. Echocardiogram utilize ultrasound to produce image of the heart and vascular structure. By using a mode, two-dimensional and three-dimensional echocardiogram, and to provide information about the direction and the velocity of blood flow within the structure using spectral Doppler and color flow Doppler mapping. Ultrasound refers to sound waves with frequency well beyond the range of human hearing. Because the ability of ultrasound waves to penetrate human tissue carries an inverse relationship to the frequency of the transmitted ultrasound. The range of frequencies that are suitable for transthoracic echocardiogram generally falls between 2 to 10 MHz. 1 MHz, which corresponds to image depth of 9 cm in premature neonates, by using 10 MHz probes. down to 30 centimeters in adult by using 2 megahertz transducer. High ultrasonic frequencies are required to produce the necessary resolution for diagnostic imaging of small cardiovascular structure in newborns. Because image resolution is directly related to the ultrasound frequency, the highest frequency that can penetrate to the structure of interest is generally preferred for M-mode, 2D and 3D echocardiogram. The opposite is true for Doppler and color flow mapping, in which lower ultrasonic frequencies generally provide better information. Low frequency sound waves have different tissue penetration but lower image resolution. High frequency sound waves have less tissue penetration with higher image resolution. Ultrasound gel is applied to the transducer to allow transmission of the sound waves from the transducer to the skin. The transducer transforms the echo or mechanical energy into an electrical signal, which is processed and displayed as an image on the screen. The conversion of sound to electrical energy is called the piezoelectric effect. Piezoelectricity is the electric charge that accumulates in certain solid materials, such as crystal, certain ceramic, and biological matter, such as bone, DNA, and various proteins, in response to applied mechanical stress. A piezoelectric microphone is used in this device to detect phasor variation in sound waves, which can be converted to an electrical signal for processing. There are 5 basic components of ultrasound scanner. The first is pulse generation that apply high amplitude voltage to energize the crystal. Then the transducer to convert electrical energy to mechanical energy and vice versa. The third is receiver to detect and amplify weak signal. And then the display to display ultrasound signal in a variety of modes. And the last is memory for store video display. Transducer is a device that converts energy from one to another. The transducer in echocardiogram is responsible for both transmitting and receiving the ultrasound signal. This transducer consists of an electrode and a piezoelectric crystal whose ionic structure in deformation of shape exposed to an electrical current. Piezoelectric crystals are composed of synthetic materials such as barium titanate, which when exposed to electric current from the electrodes, alternately expand and contract to create sound waves. When subjected to the mechanical energy of sound from a returning surface, the same PE element changes the shape, thereby generating an electrical signal detected by the electrodes. The doctor can use an echocardiogram to determine how well the heart is pumping blood, assess the reason for an abnormal electrical test of the heart, diagnosis heart disease, including weak pumping or stiffening of the heart muscle, leaky or blocked heart valves, and chamber enlargement, locate blood clots or tumors, assess the pressure in the heart to diagnose a condition called pulmonary hypertension, to identify congenital heart abnormalities in infant and young children, and monitor how well the heart responds to different heart treatment. Example, heart failure medication or artificial valves and pacemakers. There are several types of echocardiogram, such as transthoracic echocardiogram, transesophageal echocardiogram, Doppler echocardiogram, stress echocardiogram, and fetal echocardiogram. Transthoracic echocardiogram is the most common type of echocardiogram test. This type of echo, placing a transducer on chest near the heart, the device sends sound waves through the chest and into the heart. In the standard type of echocardiogram, a technician or sonographer sprays gel on a device or transducer. The sonographer presses the transducer firmly against your skin, aiming an ultrasound beam through your chest to your heart. The transducer records the sound waves echo from your heart. A computer converts the echo into moving image on a monitor. This device can provide a lot of information about the heart chamber, valves and muscle, and the performance of the heart. The next type of echocardiogram is transesophageal echocardiogram. A transesophageal echocardiogram is a procedure to look at your heart chamber and valves using flexible telescope placed down your esophagus. Transesophageal echocardiogram uses a transducer mounted at the end of a long, flexible tube that is carefully inserted into your food pipe through your mouth. A transesophageal echocardiogram uses a thinner transducer that attached to the end of a long tube. The patient will swallow the tube to insert it into the esophagus, the tube that connects to the mouth and the stomach, which run behind the heart. This type of echocardiogram provides more detailed picture of the heart compared with the traditional transthoracic echocardiogram because it gives a close-up view of this organ. Transesophageal echocardiogram is especially good at examining the atria and the valves of the heart. It is often used in the people who have atrial fibrillation to look for blood clots in the atria, or to see if there is a bacterial infection of the heart valves or endocarditis. Transesophageal electrocardiogram is also better than transthoracic echocardiogram at detecting aortic aneurysm or enlargement of the aorta and congenital heart defect. A transesophageal echocardiogram is usually used to help assess a problem with one of your heart valves and can show if it is possible to repair or replace that valve. A transesophageal echocardiogram is also used to help guide the heart specialist during procedure to close holes between heart chamber or insert device. If you need a controlled electric shock to treat an abnormal heart rhythm, a transesophageal echocardiogram is sometimes used first to check if you have a blood clot in any of your heart chamber. The next is Doppler echocardiogram. Doppler echocardiogram is a procedure that uses Doppler ultrasonography to examine the heart. Doppler ultrasonography is medical ultrasonography that employs the Doppler effect to generate imaging of the movement of tissue and body fluid. Doppler echocardiogram commonly used to check the flow of the blood. An echocardiogram uses high-frequency sound waves to create an image of the heart, while the use of Doppler technology allows determination of the speed and direction of blood flow by utilizing the Doppler effect. Doctors use Doppler ultrasound to check the flow of blood. They do this by generating sound waves at specific frequencies and determining how the sound waves bounce off and return to the transducer. Doctor can use color Doppler ultrasound to map the direction and velocity of blood flow in the heart. Blood that flow towards the transducer appears red, while blood that flows away looks blue. The result of Doppler ultrasound can reveal problems with valves or holes in the walls of the heart and assess how the blood is traveling through it. The next is stress echocardiogram. Stress echocardiogram is done as part of stress test to determine how well your heart and blood vessel working. During this test, patient exercise on a treadmill or stationary bike or take medicine given by your doctor to make your heart work hard and beat fast. Then the doctor monitor your blood pressure and heart rhythm. When your heart rate reach peak level, your doctor will take ultrasound image of your heart to determine whether your heart muscles are getting enough blood and oxygen while you exercise. Your doctor may order a stress echocardiogram test if you have chest pain that they think is due to coronary artery disease or a myocardial infarction, which is a heart attack. This test also determines how much exercises you can safely tolerate if you are in cardiac rehabilitation. The test can also tell your doctor how well treatments such as bypass grafting, angioplasty, and anti-angial or anti-arrhythmic medication are working. The echocardiography stress test is very reliable. Your doctor will explain your test result to you. If the results are normal, your heart is working properly and your blood vessels are probably not blocked due to the coronary artery disease. Abnormal test results may mean that your heart isn't pumping blood effectively because there is a blockage in your blood vessel. Another reason could be the heart attack damage in your heart. Diagnosing coronary artery disease and assessing your risk for heart attack early on can help prevent future complications. This test can also help determine if your current cardiac rehabilitation plan is working for you. The last is fetal echocardiogram. Fetal echocardiogram is used to look at an unborn baby's heart. A doctor may recommend this test to check a baby for heart problem. When recommended, the test is commonly done at 18 to 22 weeks of pregnancy. For this test, the transducer is moved over the pregnant human's belly. This is the end of my presentation. Thank you.